Alzheimer's disease is the sixth leading cause of death in South Carolina. Early onset dementia and Alzheimer's disease diagnosis is up nearly 200% since 2013. We sat down with Taylor Wilson from the South Carolina Alzheimer's Association to discuss some unique problems for South Carolina.
The association report says that we are diagnosing people earlier. That's obviously a good thing. Is that also the case here in South Carolina?
In South Carolina specifically, what we're looking at is we're the third largest neurology desert in America.
What does that mean?
So a neurology desert means that we lack the necessary neurologists and neurology infrastructure to be able to appropriately diagnose and also help to treat, because really Alzheimer's has no cure or treatment or way to slow it down, but there are medicines that can help with the cognitive decline and kind of keep someone a little bit more available to their family to make some long-term decisions before the medicine may stop working. So we're treating symptoms, not the disease.
Because there is no cure, you're only treating symptoms. It makes it seem like it's a very gray area, right?
So I think that's something that's really important. As a neurology desert, the other thing that's really concerning is that because we don't have the neurologists in place and there's a long waiting period, we need to focus on our primary care providers to be able to do early detection and early diagnosis. And that's been a big push federally. We actually just got legislation passed that's going to release some money so that we can do some public awareness and public health campaigns specifically targeting early detection and early diagnosis for primary care providers. They're the first line of defense. You're talking about, South Carolina's an 80% rural state. Your primary care physician may be your only doctor in town. That may be the doctor who does, dermatology and everything else. So, and it may not even be a doctor, it may be a nurse practitioner. So when we're looking at South Carolina, truly first line of defense for early detection, early diagnosis is going to be those primary care providers, but we've got to get them educated first.
Any particular hurdles that make South Carolina a little different than other places in the country?
So South Carolina's in the stroke belt. We have poor health outcomes for other things like diabetes and different things like that. And again, we talk about the connection of brain health and body health. If you have a body that has a higher risk of stroke, higher blood pressure, we know that all of that is connected to potentially some damage that can occur to your brain. People who have a stroke are actually more likely to get dementia as they age.
If you had to give a person one thing to remember out of this, what would it be?
This is going to sound strange, but I say breathe. Just take a breath. I know you're feeling very overwhelmed right now, and I know you're terrified. They are too. It's going to be okay. If you see someone who is experiencing cognitive decline, please encourage them or their caregivers to take them to a primary care provider as soon as possible. And when you get to talk to them, remind them to tell the primary care provider they need to test them for cognitive decline. That is really key. Early detection, early diagnosis, that is going to make the biggest difference for the quality of life for the person who's diagnosed, but also the caregivers.